Chris Altman, Clinical Manager of Immunizations and Clinical Programs. We don't receive a lot of questions about drug testing at the pharmacy. When we do, if a patient's in seeking a kit, that's usually when we'll see the questions. Because they're located so close to the pharmacy counter, oftentimes patients will come in there, they'll see the range of tests, and that will spur the questions. Typically, we don't see patients coming in knowing exactly what they want, grabbing it and going. When they come in, they'll have questions, but it's not something we see often or on any kind of common basis. Generally, the customers we see that are buying the kits are parents or caregivers or family members with some suspected drug use in the house. I don't see a lot of patients buying it for themselves. Generally, they're buying it to test a caregiver or test a loved one that they think is possibly using medication. Usually we see the customers that are purchasing the kits, they're using it because they want to test someone that they are suspecting some diversion. So it's they have medication at home, they're suspecting someone else in the house may be using it, or oftentimes, more likely than not, it's going to be a parent testing their children because they suspect their children are using medications or using drugs outside of the home. As an abuse prevention tool, the kits really help to give at least that baseline knowledge to the caregiver or to the person who's checking for the use. I think that's a big piece of it. There's a lot of questions about, as a caregiver, as a parent, or as a guardian, if you don't know the answer, if you don't know that they're using, it's hard to help those individuals. So I think being able to know if there is behavior that's unusual out of an individual, is it being caused by drug abuse, and that kit gives them that baseline. Also, I think once someone knows that the potential out there is to test, it may cause them to rethink going there and rethink using the medication because they can get caught, right? There's a potential where if they do use, someone's going to be able to go back and say, I know you were using, and then be able to take the next steps to help them. Personally, I'm very comfortable with discussing drug testing. I really think it is something that is a needed tool when we're talking to patients, and I think it's a needed tool to make sure that the patients, number one, can test and know if there is drug abuse. And with the current climate we're in, that really is such a high point that pharmacists are really being asked to help. So the comfort level there is really just knowing that it is providing that help to the patients. So I feel like having those conversations are benefiting them, so that really helps me with the comfortability. My biggest concern with the kits is making sure that they are going to give an accurate response. I think that's something that's shared amongst other pharmacists as well, as knowing that if we are using these kits and the patients are getting some sort of a response back, that it's going to be an accurate response, because either direction can be painful to a patient. Either direction, whether it's a false positive or a false negative, is going to influence decisions. It's going to make it very difficult for us to really have a good conversation and really drive home our message here, which is helping those patients with those drug abuse. I think there is a stigma around drug testing. The thing as a parent for a child, it's almost like admitting that your child is using medication. So I think the stigma is there. You may have failed that child, or you may have failed to protect them from potentially having some drugs available to them. I think there's a stigma around even if you're testing another loved one, so maybe it's not even a parent or a child. You have to have that conversation with the person you're testing to say, I think this is possibly a problem and I want to know so I can help you. I don't know that it always comes off that way on the other end. So the person being tested may not see it as, you're testing me because you want to help me. It's, you're testing me because you don't trust me, or you're testing me because you think I'm behaving oddly, or I think that really drives that stigma behind it.